Thank you for coming to Logos Health.
Be put to sleep.
You sound like my husband. Oh my gosh. He has to get a cavity filled. A cavity.
Those are the worst though.
He said put him to sleep. I said for a cavity.
I would rather be put to sleep during that.
I said
It hurts. It does hurt.
Clean you off here. So I'm gonna start just by cleaning you off. I'm using a circular motion. And then I've got this little povidone iodine stick, and it is brown, so it's going to stain your leg a little bit, okay? What we're doing today is what's called a punch biopsy, which is a small sample of this lesion. This patient's had this for quite some time and it's been growing. It's not really painful. It doesn't really cause her any discomfort. She just wants it gone so she can be sexy, okay? And show her legs. So before I remove it, I want to make sure that there's not any signs of anything concerning like a precancerous cell or a cancerous cell. So we'll do a biopsy and I'll get a small sample of that lesion. I'm going to send it off to the lab in this little solution of 10% neutral buffered formalin. They'll do a biopsy sample and they'll look at it under the microscope and give me a pathology report, and they'll tell me what cells are there and if I need to do any follow-up or if there's anything I need to be concerned about. So while that is drying, I'm going to go and throw up my lidocaine because she wants to be put to sleep for this. I'm going to start by numbing the base of it. And so this is just a little bit, it's 1% lidocaine solution. So we're just going to go right there underneath the lesion. And I typically inject about 2 mils of lidocaine here, and then I'm using this approach where I'm not completely withdrawing the needle. I'm almost taking it out and making sure to cover the entire base there, because I want her to be good at numb. She's already told me she doesn't numb very easily, so. All right. Now we're gonna let that sit. It takes just a few minutes to numb. Oh, she's a bleeder. You're not injecting a digit, so like a finger or a toe, you can use lidocaine with epinephrine, and that is a vasoconstrictor, which means it will stop the bleeding. But this is what I had, so we're using just plain old lidocaine. So she may bleed a little bit more, but that's okay. This will stop on its own. And she doesn't have any history of any bleeding disorders. She's not on any blood thinners or anything like that. So I don't have any concerns for any prolonged bleeding. Before I do anything, I always check to make sure the patient's numb. So we'll test this small area. I'll ask her to tell me if she can feel it. If she can still feel it, I'll ask her what does she feel. So she may feel some dullness or a little bit of pressure. She should not feel anything sharp or poking her. And if she does, it means she's not numb well enough. We need to numb her up again.
I just feel kind of pokey, kind of sharp.
Okay, what about right here?
I don't feel anything.
What about right there?
Same as the other, just a little pokey.
Okay. I'm gonna give you just a little bit more numbing medicine, okay?
Well, I didn't feel that.
Good.
So.
Good. This is a dermablade, which is often used for dermal piercings. So, you know, those that have dermal piercings are familiar with this, but it's a pretty cool instrument to use. We're gonna make what's called a circular incision there. Now I'm gonna do right here in the center. So we're just kind of squeezing or turning our way in there. You doing okay? And then that's it. Did you feel that?
No.
Okay. I'm gonna take this and I'm gonna drop it in that solution. And the only reason why she's bleeding this much is because we did not use epinephrine. But you see there's just a tiny little hole there. You did great.
Thank
You
you. Yeah, I
really
didn't even
good.
feel it at all.
Did you not? Good. Good.
No.
That's really good. Clean you up because I don't like having dried blood everywhere. So I'll take an alcohol wipe here and just clean you off there. You may bruise just a little bit. Some people do, and you're more pale, so that's not uncommon. And then I'm going to put a little piece of gauze here to capture any additional drainage that you may have. And look, when I move that out of the way, this is a non-adherent pad that we'll cover that up with. And I'll use a little bit of tape here is what I'll use. And because you did have some extra bleeding, I'm going to have you to leave this on for the next 24 hours, okay? All right. That's it, dear. And we will follow up as soon as we get the pathology report back from the lab. You're all set.